The grave consequences of halting golden rice cultivation in the Philippines, a scientific lament. The recent court decision in the Philippines to prohibit the cultivation of golden rice, a genetically modified, GM, crop engineered to combat vitamin A deficiency, has sent shockwaves through the scientific community, who vehemently condemn the ruling's dire implications. They warn that this decision could lead to the tragic deaths of tens of thousands of children. In 2021, the Philippines became the first country to approve the commercial cultivation of golden rice, a groundbreaking development aimed at addressing the severe vitamin A deficiency that plagues children in many parts of the world, causing widespread disability and mortality. However, last month, a successful campaign by Greenpeace and local farmers convinced the country's Court of Appeal to overturn this approval. The groups argued that golden rice lacked proven safety, an assertion endorsed by the court, a victory hailed by Greenpeace as monumental. Despite these claims, a multitude of scientists assert that there is no scientific evidence to suggest that golden rice poses any danger. In fact, they maintain that it is a life-saving intervention. The court's decision is a catastrophe, declared Professor Matten Kame of Bonn University, a member of the Golden Rice Humanitarian Board that advocates for the crop's introduction. It flagrantly contradicts scientific evidence, which has found no indication of any risks associated with golden rice. This decision will result in the needless deaths of countless children. The Philippine government has vowed to challenge the court's ruling, and agricultural experts predict that it will likely be overturned in the near future. However, the setback is expected to have far-reaching consequences. Countries like India and Bangladesh, where vitamin A deficiency is similarly prevalent, had been considering introducing golden rice but are now likely to be discouraged. The situation is deeply alarming, said Adrian Dubach, another board member. Planting golden rice was not driven by profit. It was not about controlling what farmers grow or what people eat. It was solely about saving lives. In Western diets, vitamin A is abundant in most foods, but in developing countries, it is strikingly absent, a deficiency that the World Health Organization identifies as associated with significant morbidity and mortality from common childhood infections and is the world's leading preventable cause of childhood blindness. Estimates indicate that this deficiency claims the lives of over 100,000 children annually. Seeking a solution, Peter Bayer, professor of cell biology at Freiburg University in Germany, and Ingo Patricus of the Institute of Plant Sciences in Switzerland, embarked on a pioneering research endeavor in the 1990s, leveraging the burgeoning field of genetic manipulation. They successfully inserted genes into the DNA of ordinary rice, creating a variant capable of producing beta-carotene, a vibrant orange-colored pigment that serves as a crucial precursor for the body's synthesis of vitamin A. This innovation, known as golden rice, has since been proven to be an effective source of vitamin A for humans. Countries such as the United States, Australia, and New Zealand have deemed golden rice safe for consumption. Nevertheless, despite 3 decades of development, it has yet to be commercially cultivated, largely due to the Green Movement's staunch opposition to the cultivation of any GM crop, regardless of its potential benefits. Golden rice was the first transgenic crop designed to benefit people, not companies or farmers, yet its use has been obstructed from the outset, Patricus lamented to The Observer last week. I am deeply concerned about the Philippine court's decision, not only for its impact on the adoption of golden rice but also for its chilling effect on the development and cultivation of other transgenic crops. This concern is widely shared among scientists. In 2016, over 150 Nobel laureates signed an open letter condemning Greenpeace's campaign against golden rice and other GM crops. They asserted that Greenpeace had grossly misrepresented the risks, benefits, and impacts of genetically modified food plants, emphasizing that there has never been a single confirmed case of a negative health outcome for humans or animals from their consumption. Despite these scientific reassurances, Greenpeace remains steadfast in its opposition. There are specific concerns with golden rice, asserted Wilhelmina Pellegrina, head of Greenpeace Philippines, last week. Farmers who brought this case with us, along with local scientists, currently grow diverse rice varieties, including high-value heirloom seeds that they have nurtured for generations and over which they have control. They are rightly concerned that if their organic or heirloom varieties become intermixed with patented, genetically engineered rice, this could jeopardize their certifications, diminish their market appeal, and ultimately threaten their livelihoods. Pellegrina further argued that relying on a single crop system to address malnutrition undermines resilience and heightens vulnerability to climate impacts, a pressing concern in the Philippines, which ranks among the world's most climate-vulnerable nations. If the system fails, it is the farmers and consumers who will bear the brunt. She emphasized that there are more practical, proven strategies to combat vitamin A deficiency, such as food supplementation programs and promoting the cultivation of a diverse range of crops, including those rich in vitamin A. These are the areas where attention and investment should be directed, she concluded. The ongoing debate surrounding golden rice underscores the critical need for evidence-based, especially when the lives of vulnerable children are at stake. The overwhelming scientific consensus affirms the safety and efficacy of golden rice as a life-saving intervention. The court's decision to prohibit its cultivation is a profound setback that could have devastating consequences for countless children around the world.